This is a B-Lite implant if you're interested. That's what a B-Lite implant looks like. That's sort of like a normal silicone implant. Does that, can you see that? B-Lite is the white, oh no, sorry. B-Lite is the white one. This is a B-Lite implant. This is a normal silicone implant. People get very worried about types of implants and makes of implant. Most implants are textured silicone implants. To be honest, both a B-Lite implant and this implant, they are both textured silicone implants. So I've just done a blog about this, about the different types of implants. I've lost an implant. Lost an implant. Sorry, I found it. Right. So basically, I think people worry about it more than they need to, really. Most implants are, well, all implants have got a silicone shell. So sometimes people will say, I don't want any silicone, I want a saline implant. Well, that's fine, you can have a saline implant, but it's still a silicone shell, it's just saline inside. We don't tend to use much saline implants in the UK. Most implants that we use, pretty much all implants really, are silicone implants. That means they are a silicone shell with silicone gel inside. Now, there's only one company in the world that makes the silicone for breast implants. It's in Texas, so every single breast implant has got the same gel in it. So people who say, oh, this make is better than that make, oh, you know, you want to have these are the best, you know, it's not that much to choose between them because they've all got the same gel in them. So you can't really choose, and the main things you can choose are the coating. Now I say they've all got the same gel in them. The polyurethane, oh god, the B-Lite one, this one, the white one, is a textured silicone implant, same as this. So here we go, Tracy. Do they feel different? No. They're both textured silicone implants, a silicone textured shell with silicone gel inside, and they both feel the same. These are slightly different. No, these ones, the white one, sorry, it's reversed. When I look at it there, my hands are reversed. I should look at real life. This is the B-Lite implant. So the B-Lite implant is slightly different because the silicone has got microspheres bonded to it, which makes it lighter. So it is lighter than a standard silicone implant. So it's still silicone gel, it's still a silicone shell, but it's the silicone inside is bonded to these microspheres, which make it lighter than a standard silicone implant. So, but when people get hot under the collar about different makes of implants and things, it's not really, you don't really worry too much about the different makes of implants, to be honest with you, because they're all, I mean, the vast majority, to be honest, are like these textured silicone implants, and there's not a huge amount to choose between the different makes. You could have a smooth silicone implant, and we're using these. These are sort of coming back in now because of ALCL, which is a type of cancer that's been associated with implants. It's only sort of come out recently. All the cases of ALCL have been in textured implants. It's a very rare thing. But nevertheless, there are no cases with smooth implants. So some surgeons are saying, well, I'm going to use smooth, or some patients are saying, I want a smooth implant because there's no cases of ALCL with patients with smooth implants. And that's absolutely fine. You can have a smooth implant if you want. The couple of things about the smooth implant is that you can't have a teardrop. Can you see that? That's a teardrop. So you can't have a teardrop if you're having a smooth implant because it just rotates. With the texturing makes it rotate less. If you really don't want it to rotate, and actually this is something that someone was on earlier on the live thing, you have a polyurethane. This is a polyurethane teardrop implant. But anyway, so a smooth implant, you can't have texture, you can't have teardrop because they rotate, and they've got a higher rate of capsular contracture compared with a textured implant. But nevertheless, they there is a no cases of ALCL with smooth. So some people are using smooth. So what are your options? Your options are smooth or textured, so you can make a decision on that. And it's all about knowing the risks and balancing the risks with the benefits. So, but if you have the different makes, certainly with a smooth, what's going to be different between a smooth silicone implant with different makes? Mainly around the warranty, really. So you need to look at the warranty because the warranties are slightly different. We've got some questions. So does one last longer than the last day? Is the heavier one more likely to drop? Right. Okay. Good. Two good questions by Roxana Australia. Roxana Australia with two good questions there. Blimey. Alrighty. So question number one: does one last longer than the other? So in terms of these two, which are the B-Lite implant and a standard silicone implant, they don't last any differently. They both last the same. And when you say last, there's two things really. Number one is rupture. Rupture is pretty rare these days, and they're all form stable, which is cohesive gel. Sarah's desperate for me to cut an implant live on video so you can see, but basically if you cut it in two, they stay intact. They don't sort of leak liquid silicone. So rupture is less of a problem because even if the shell does fail, they don't leak liquid silicone. But the other problem you get is capsular contracture. As I say, smooth implants have got a higher rate of capsular contracture than textured implants, but between a B-Lite implant and a standard silicone implant, both are textured silicone implants, so they'll both have the same risk of capsular contracture. So in those terms, they would last the same. Now, if you are worried about the lasting, there is these ones, which are this is a polyurethane foam implant. So again, it's a smooth silicone implant. It's a smooth silicone implant in there. That is a smooth silicone implant, but it's got a foam coating around the outside. And these do last slightly longer, the polyurethane ones, because they're much less likely to go hard. So they're much less likely to need to be changed. So basically, in terms of implants, most implants are textured silicone implants. The two real differences is not so much in the makes and what have you. The two real differences, if you're thinking having breast implants, is in terms of the B-Lites. So B-Lites are different because they're lighter, and polyurethane. Those are the two sort of different types of implants you can have. Both of these are made by Polytech. It's a German company. So if you want either a B-Lite implant or a polyurethane implant, you have to have Polytech. And they both got advantages and disadvantages. But if you want a silicone textured implant, which is probably the majority of the implants we use in the UK, there's different makes, but I wouldn't worry too much about the different makes because there's not a lot to choose between them. Roxana has said, is the heavier one more likely to drop? Well, yeah, this is the reason why the B-Lite implants exist, because obviously the weight of the implant, having a lighter implant is going to be good. It's going to be less sort of tension on the tissues. And so, I mean, the one thing you've got to remember is you still have got breast tissue. So your breast tissue might drop, especially if you've got a big breast. But most people having breast implants don't have a lot of breast tissue. Otherwise, they wouldn't be having implants. But if you have got a lot of breast tissue, your breast tissue might drop. So if you're thinking of an augmentation mastopexy or something like that. But the main benefit of the B-Lite implant, the implant itself is very light. So it is less likely to have traction on the tissues, and it's a lighter and so less force. It is more in my view, it's more for the bigger sizes. I think it's more of a thing. In the smaller sizes, the difference is less. They say it's 30% less. I think it is in weight, heavier, 30% less heavy than the standard silicone implant. They're very expensive, is the B-Lite. That's one thing about the B-Lites. The B-Lites are more expensive. Polyurethane are more expensive. So these are expensive implants, these B-Lites and these polyurethane implants. But as I say, they are a bit different to silicone textured implants, and I think it's worth considering. But if you're considering a textured silicone implant, I wouldn't get too worried about the specific make that you have, because I don't think that's going to make a tangible difference. I think it's reasonable to decide whether you're having a polyurethane or a B-Lite, but within the realms of textured silicone implants, the makes don't matter that much. Someone on the online chat earlier was asking about specifically wanted to find a clinic that do teardrop polyurethane. This is a teardrop polyurethane implant. And yes, we are a clinic that do teardrop polyurethane implants. And the main thing about teardrop polyurethane is that, number one, obviously polyurethane have got a much lower rate of capsular contracture, as I said a minute ago. But the other thing about polyurethane is they're much less likely to move. Now, a lot of people worry about that when you say less likely to move. They think, oh, they're going to be stuck. They don't stick. They still feel like normal breasts, but the implant is less likely to move. So certainly with a teardrop implant, there's a risk it can rotate. Obviously, if you have a round implant and it rotates, it doesn't matter because it's round. It's just sort of round the way around. But a teardrop one, because it's fuller on one end than the other, if it rotates, it looks odd. And so teardrop, that's another plus about polyurethane. They are much less likely to rotate. But as I say, there are pros and cons of polyurethane, pros and cons of B-Lite, pros and cons of silicone, pros and cons of smooth shell and textured shell. And it's they